For a few years, I have further improved the laparoscopic totally extraperitoneal hernia repair, and I've reduced the number of incisions and the size of incisions to perform the operation. And especially the size is very important, and by changing the approach, it's extremely helpful to perform the operation exactly the same way as we would do with the standard laparoscopic totally extraperitoneal repair, but also to have smaller cuts where the postoperative pain is less, recovery is quick, and there is no restriction on the patient to get back to their exercise. And we do allow our patients to start their activity from the day of the surgery and carry on and build up on that, and there is no restriction to exercise, lifting weight. Though they should be aware that generally any cut in the skin or in the body can take up to 3 weeks to become completely painless. And for the first 3 or 4 days, they can expect to get some pain and discomfort, and they should keep their activity levels low. But gradually, once they are comfortable, there is no restriction from this aspect of repair of hernia, and that's very important. Laparoscopic approach has taken away the patient factor out of the hernia. So if a patient's body or the muscle is weak, or if they have any comorbidities which may lead to poor healing or slow healing after the surgery, or if they do some activity, lift something heavy, none of that should cause any issues as far as the long-term outcomes and the results of the hernia repair are done. And the recurrence rate is not expected to be any higher in those patients. And this is of a huge benefit to the patients who are self-employed and their job depends on their physical activity and lifting heavy weights.